Hello and welcome to this News 9 special with me, Surat Suresh. Well, the number of cases of COVID-19 continue to rise in Karnataka, but so far it seems to be under control. Well, to discuss how well Karnataka government is dealing with COVID-19 crisis, we have with us Deputy Chief Minister Ashwath Naryan joining us in our studio. Many thanks for joining us, sir. Firstly, we have been seeing how the Karnataka government has been trying to tackle the pandemic from the time it was even reported in Karnataka to this point. We have close to 105 cases in Karnataka at this point in time. So how is Karnataka government looking at this pandemic at this point in time, coming through the days?
Since now already few months already we have passed on, and the month of the March has been very important with regard to the COVID-19. The government of India, government of Karnataka took a lot of measures. Basically, this is an imported disease, been imported from different countries. The origin being from the different countries, we tried screening and curtailing in the most of the airports and ports. We tried our best to screen them there itself. Somehow, many of them were asymptomatic and they looked very normal, and they were not showing any signs of being infected. Whoever showed the signs of infection or the signs or symptoms of virus being infected, they were taken under the isolation and they were quarantined, and all the required measures were taken. But the people who went through the scanner and they passed through the screening, and you know very well, already more than 2 lakh people have come into Karnataka through various airports. That is through Bengaluru, 1.5 lakh people, and different airports, more than 50,000 people. Now we are trying to track all these people, track and monitor and isolate them. Wherever we are receiving any kind of signs and symptoms, they become symptomatic. We are trying to track the cases and as well as the primary and secondary contacts, so that entire disease will be contained and restricted to particular families or the individuals. And so far we have been doing this, and as well as along with that, we came out with a clampdown. Even before the clampdown, we took a lot of measures to shut down the schools, colleges, malls, cinema theaters, pubs, restaurants. We did many of the measures, and now we are coming out with a complete clampdown. So
now,
that
before we understand, those measures which have been taken, the epicenter or so-called epicenter at this point in time will be Nizamuddin, and that particular area, even Kannadigas had gone. People from Karnataka had gone. There are already so many people who have been quarantined. In Mysuru as well, we have already seen how 19 of them, and even for that matter in Kalburgi as well, in Bengaluru as well, many of them had travelled to Nizamuddin. So with respect to that, what are the measures which are being taken at this point in time? Because we will have to consider how many people had gone there.
The most important part in this disease is tracking, isolating, tracking. The most important part is the tracking. Wherever, whatever information we receive, there is a suspect that a person is been exposed to anywhere, any coronavirus, any basis of the suspect itself, we just try to quarantine, make sure they'll be quarantined in their respective houses. Otherwise, under the supervision of the government. We feel that home quarantine will not be good enough, sufficient enough. We will be taking them under the supervision of the government. And here, with regard to the specific case of the Nizamuddin Jamaat, the event which took place in the March 13 to 15, we had one death also in Sira. We had one death in Sira, who the person was connected with the Nizamuddin Jamaat event in the Delhi. And we were trying to find out wherever they have come in contact with the history, with the foreign travel history, or the people who are convoyed in particular places. There are people who are exposed and infected. All of them together, there will be very good chances of contacting this disease very easily. So that being the case, now we are trying to find out who went to this Nizamuddin event, and we are trying to track them now and find out, and even the close primary, secondary, all the contacts we are trying to quarantine and establish the contact with all these people, and we are trying to find out the identity of the people who went and participated with this event, and we are making sure all of them will be traced and tracked and isolated and kept in quarantine.
Now, what is the state government's appeal? Because at this point in time, we know that they had traveled by train, they had gone via road as well. So, your appeal as a Deputy Chief Minister to those people, because the Railway Department as well has already asked people to come forward, get themselves tested. So, as a Deputy Chief Minister, what is your appeal to the people?
Sir, basically, they need to come forward. Most of the time, voluntarily, this kind of people who have been exposed, who were been made to understand that the place you had been, there was a very good chances of contracting this disease. So we are trying to reach out to give an open call through the media and through various sources. We are trying to convey to them that this is very important for you to come and voluntarily come out and cooperate the government to so that we can quarantine these people, take the necessary measure. If not, their entire family, their relatives, their community, everybody is going to suffer. In this way, the entire society will be facing this problem. We are humbly requesting them to come out voluntarily and cooperate. See, this is not the thing, you can't keep it in secret, you can't live in isolation. See, anyhow, you will come in contact with many people. So it is very difficult to keep away from all these things, and moreover, most of them are coming voluntarily forward coming forward and communicating or reaching out to the system organization and declaring on their voluntarily. Whoever is not coming, we are trying to trace out the individuals who had been to Nizamuddin. We are trying to take out the list from the Jamaat, Delhi Jamaat itself, the people who participated from Karnataka, so that we can trace them easily and keep them in quarantine.
Absolutely. Now, special arrangements have been made for the same as well, because you will have to trace them out and their primary contacts, their secondary contacts, and as well as if they'll have to be placed under home quarantine, asymptomatic, symptomatic, all of these will have to be traced out. So, special arrangements have been made for them as well in Karnataka for tracing out the people who have traveled to Nizamuddin.
Yeah, the most important part of this disease is tracing, tracking, tracing, isolating. This is the most isolating and quarantining. This is the most important part of this disease. The second comes the preventive measures.
Correct.
So the first and foremost, if you are able to track and trace the infected people, the exposed people, the contracted people, the people who are working closely with them, that is the number one priority. Time and again, this is the most important part. If this is not done properly, we'll end up in many problems. There will be scope for anything to happen.
Well, absolutely. At this point in time, we'll also want to remind our viewers, a week back, Dr. Ashwath Naryan had said, possibly Karnataka could be looking at 1 lakh people if they do not come forward and if they do not report themselves. So, with respect to that, if you can tell us how you came to a consensus that, somewhere 1 lakh people could test positive if this continues, this trend continues.
Sir, basically now government of Karnataka has taken a Italy model. A maximum infection, what has happened in Italy, it is 0.15% being infected, chances of being infected. Based on that maximum numbers, the government of Karnataka is anticipating 47,000 to 50,000 people. And moreover, the maximum, what we can anticipate, what we have been insisting, so that nothing should be surprising. So we have been insisting, gear up for 1 lakh, gear up for 1 lakh, so that nothing should be surprising. Suddenly things go wrong. We should be in a position to handle.
Because everyone speaks about community transmission.
We should be in a position to handle any kind of challenge.
Correct.
So that's the way forward. God, I don't think so. In the present condition, what we have been doing extremely well, I don't think so. Things will go out of hand. That I can tell you now. Probably I am very hopeful that I think things will be in control and nothing will go out of hand. That's my personal opinion, I can say personal opinion, that things will not go out of control, but it all depends how people cooperate. People, how they cooperate, participate, by extending their cooperation, probably by distancing, staying in home, staying in isolation, not getting out, not coming in contact with the people, that will contain this disease. This disease basically spreads by contact.
Exactly.
See, as all of us understand, this basically happens through contact. It's better since we have gone for the lockdown, we need to per se 100% implement the lockdown. IT industry, the most important industry, effectively I'll tell you, this shutdown, it has not affected them.
Well,
all
of them are working from
I
home.
should thank in this juncture all the internet service providers, BESCOM, and all the utility service providers. Because of their support, not this IT industry has not been affected in any way. They have been doing their work, working from home, and they have been doing their job very effectively without none of these industries being affected. I really, that's the way forward.
If any of you want to ask any question, we have opened our lines here. Well, the Deputy Chief Minister himself will be answering the questions. What kind of measures have been taken by the government of Karnataka and how they can avail these services as well, which is being provided? Well, you can call on the number 08040312757 or 58. Well, this is our number. We have opened our lines. You can call in. You can ask your questions to Dr. CM Ashwath Naryan here. Now, on the other hand, we have spoken about how people have to support the government's initiatives at this point in time. But we have to also speak about the precautionary measures which the government has taken with respect to how many beds have been prepared, because we will have to be prepared, like you said, we have to be prepared for 1 lakh cases in Karnataka. If that is the case, so how many beds have been purchased and how many hospitals have been taken over just to ensure that yes, we are prepared, we can tackle this pandemic even if we are going to be seeing a large number of cases?
Basically, 80% of them will be asymptomatic. Rest remaining 20% of the people, definitely it can be easily handled at present. Even with the step-up facility, 3,500 beds have been provided, and we do have many medical colleges where we have sufficient beds, can accommodate any number of patients can be accommodated. I don't think so it should be an issue. Already most of the districts, they have made provision for not less than 200 to 300 minimum strength facilities have been created. I think we are in a position to handle any of the numbers. Government literally it has prepared for 50,000 people, and extending it to 1 lakh is not a big issue, since 80% of them will be asymptomatic, rest remaining 20%, they need some kind of hospital care, and that 4% will be more serious, where they need a lot of ventilators,
right,
more
very
assisted
important
support, all this intensive care facility.
We've already seen 2 of them are in the ICU at this point in time. They're being treated for the same.
Looking at the numbers, it is very, looking at the 105
Correct.
numbers, I think having 2 in a ventilator is a small number.
It's a small number.
Actually, it is not even 4%.
Correct.
Sir, not even
Correct.
4%. Luckily, we are in a safe position, and hopefully the same thing stays and we'll get out of this entire situation. The curve has been, it has been downside, not in up, not even flat, it is going down.
No, but at the same time, it is said that the doctors and nurses, they have been requesting, especially in hospitals like Victoria Hospital or Bowring Hospital, they have been requesting the Deputy Chief Minister himself that, proper masks need to be provided, because probably there is a shortage for masks in the city or in the state at this point in time, but they have been requesting. So how are you catering to those as well? Because the healthcare workers at this point in time, they are our soldiers, they have been on the front line.
Sir, the required safety gears have been provided. Without the safety gears, there's no question of, there's no point allowing any of the staff, let it be nurse, attenders. If any one person is been exposed, we are, instead of doing something good,
Correct.
we are doing something bad. So any of them one gets infected, it will spread more easily.
Correct.
And we are making sure nobody, as the protocol, standard protocol is there, without a safety gear, they are not supposed to examine any patient. All the required safety gears have been provided to them. Their demands has been with regard to having a insurance, safety measures, having a NPS scheme. They want some of the better benefit schemes to be given to them.
And at this point in time, we should thank all those doctors, the healthcare workers who have been working for the society as well. Now, you have been talking about testing the patients here, or testing those people who have travel history, or probably they have come in contact with people. So for that, you need the PPE kits. So with respect to the PPE kits, we have heard, and there are reports that it is going to be based on the South Korean model as well. But 1 lakh kits were to be procured. So when is that going to be coming in, and will we be equipped enough with respect to testing a large number of population at this point in time? Because what we are seeing is a very minute number that we are testing here, but in the coming days, can we see that the number of kits will increase?
Sir, in the present condition, we'll be only going for the suspect cases. We'll be going only for the suspect cases. And at present, even if you look at with the new declaration, new places where we have detected the positive cases, going beyond the infected cases, primary, secondary contact, tracing, it's a big challenge, sir.
Correct. Contact tracing is hard.
Our focus has been there and on the prevention and establishing the infrastructure where has been infected to ensure that basic infrastructure will be in place. And the fourth one, providing the essential commodities availability without any scarcity. These are the 4 or 5 things we are making sure that everything is in place. Now getting into random checking all the population, that we are not getting into it. We are trying to just follow the ICMR or WHO protocols, whatever has been advised, we are trying to follow that and we are trying to do that. And we are not trying to get into all the random testing. Now whoever has been suspected, we are just trying to target that. Otherwise, what happens, any false positive, more things happen, then tracing, tracking, it becomes a big task. Even now at present, we have 1,500 teams, surveillance team or the tracking team been working only in city of Bengaluru, sir.
Absolutely.
Imagine the kind of challenges we have been working.
It surely is a challenge to track a lot of people here. At the same time, we'll continue. We have with us a caller here, Dhanak from Lingraj. Go ahead, Dhanak, your question to the Deputy Chief Minister.
Good afternoon, sir.
Yeah, good afternoon.
Good afternoon, Dhanak.
Sir, my question is, I've seen a lot of people doing sanitization everywhere. So it has been done only on the roads. What happens to the people who are staying in the lanes? So the sanitization will not be done in the lanes?
Madam, you mean to say the sanitization means the spraying of the sodium hypochlorite spraying or the hand sanitization you are talking about?
Yes, sir.
What you are trying to ask?
No,
hand sanitization or the open space sanitization?
No, the open space sanitization.
Open space sanitization has to be done in each lane, each house. The sanitation has to be done, and we are providing each ward one mechanized, motorized spraying system. Along with that, 2 hand pumps have been with backpack hand pumps have been provided, so that the spraying should happen across all the roads each day. It is not alternate days. It is not even alternate days. Each day, I think each ward will not be more than 40 kilometers, 30 kilometers, 50 kilometers. I think this spraying should be done in each ward every day. That's how we can break this chain, or the continuity can be broken.
On the other hand, Harsha from Vidyapita is joining us over the phone line. Harsha, what is your question for the Minister?
I want to speak to our Deputy Chief Minister, sir.
Yes, go ahead.
Namaste, Harsha.
Yeah, sir, Ashwath Naryan, sir.
Namaste.
Yeah, I'm really happy that for so many places, including primary health center, you have converted into COVID fever clinics. COVID clinics have been opened to treat for this COVID fever, COVID-19 fever. Okay, that overcomes that so many patients will be there, and we have got the residential area also next to that only.
Okay, you're saying that spraying process is not taking place in the area.
Next building is our flat, sir.
Sir, yes, raised an excellent question. The safety in the open spaces are the places where the fever clinics have been established. I request most of our citizens, as far as possible, unless there is a symptom, breathing difficulty, the proper right symptoms are not seen, please don't go for the fever clinics. Unnecessarily more movement of the people with smallest doubts, or smallest any apprehension, anxiety, to make sure or ensure that you are not carrying the disease, don't try to go out. As far as possible, go for the tele consultation or get some of the home delivery, home health services, home health delivery services, avail the home health delivery services, or go through the telemedicine or go for teleconsultation. That will be the best possible things to do.
We have got a notification that 36 other private hospitals as well have been added for the fever clinics at this point in time. So a lot of measures have been taken, private doctors also coming in, the entire response team also being formed for the same.
As far as possible, being online is better, unless the cases where they are sure or certain that that's a COVID-19 cases where they suspect. Those kind of cases should be personally, our health workers should go to personally to their respective places. There itself take the sample, examine them and take the necessary measure. Otherwise, getting them to all these places will lead to more contagious or spreading of disease. I feel this line 104 or many more lines should be made use and avail the services. We are not short of any health workers. Probably right utilization without a right symptoms of the COVID-19, unnecessarily calling of health workers.
That is a reason.
Health workers.
In the notification, if we go through the fever clinics, when they speak about, what they have said is that the fever clinics is only for screening process, not for testing process. So if anyone feels that they have fever, they need not directly go to RGICD or...
Yes, they should not go.
Yeah.
Even for that person who is suspected should not go, because unless he has been established that he has been infected, until then he is still a suspect. So that's the reason I just requested, avail the services of the health workers, let them come home and take the sample, swab, whatever. First they will examine. If they feel after examine, they suspect the case to having contacted COVID-19 disease, then they can go ahead with the protocols. Until then, I feel it's better to do everything from home services. Home delivery services will be the most effective way of doing things. That's how we can prevent people coming into contact with the infected person.
Absolutely. Now, Vijay Anand, who joins us from Malleshwaram itself, well, let's ask what his question is. Well, Vijay Anand, your own MLA as well as the minister is right here. What is your question?
Very good afternoon, sir.
Good afternoon.
Vijay Anand speaking. Hello?
Yes,
Vijay,
go ahead.
Hello,
go ahead.
Vijay.
Yeah, my question is, the government has given permission to a lot of individuals, like to public, to come out for public essential buying. So even people who don't have that reason misuse that and they come out. I want to know if the government can provide doorstep delivery of essentials by partnering up with private agencies or things like that. And also, I would like to tell you that the Malleshwaram constituency is doing very well regarding quarantining measures. That's it. Thank you.
Thank you, Vijay. Vijay, per se, we are encouraging all the e-commerce companies and many other companies also, even the local grocery shops also, to do home delivery. We have been encouraging almost all the business people who are handling groceries or vegetables to do the home delivery, so that it will be convenient for the people. Instead of people coming to the shopkeepers itself, they can deliver home delivery, encourage the home delivery. And this is a new model which has been well accepted by the people. They feel it is more convenient for them to get what they want will be delivered in their door. I think this is the way forward where we are looking for, and this is what we have been encouraging and we are trying to promote. And Bengaluru as well, Vijay, we have been the pioneers and we have been doing a lot in this direction.
Well, a lot of them have always looked up to home delivery.
We have been always trying to leverage the technology wherever possible. Even the people have been excellent. They have been embracing the technology very good way.
Absolutely.
I think that's a good solution, and we'll encourage. From the government is very clear about it, and government and administration always has been we have been encouraging the business people to make sure the home delivery has been encouraged, sir.
Now, you have been speaking about, the community transmission. Regarding that same, Tamanna, who has sent us a WhatsApp message where she has asked if there is community transmission which is seen in Bengaluru or in Karnataka, because the same has been reported in Chennai and Pune, where a lot of people have contracted this particular virus through community. So, are we looking at community transmission?
So far, we are not gone into that stage. So far, we are not, that outbreak has not happened, sir.
Okay.
If outbreak is happened, you will know very well know the numbers in the big numbers, you will be getting in a very big numbers. Probably in the surroundings where they have been living, where they have come into contact with the people, that's how the contracting of the disease has happened. That's how the numbers have been increasing in some places, some epicenters particularly. The outbreak has not happened so far, luckily. That's how luckily outbreak has not happened. If the outbreak happens, then definitely there's no question of keeping anything secret. This is an open government, we need to share things, we need to
Has to be transparent.
Yeah, there's no question of, keeping secret. There's nothing secrecy here, and we'll be very open and it will be very transparent. And we are trying to ensure that an outbreak doesn't happen. That's the reason we have taken all these measures. The outbreak should not happen.
Absolutely. Well, Tamanna, there is your answer. Well, clearly there is no outbreak. There is no third stage which you are going to be looking at in Bengaluru or in Karnataka as well in the near future as well, because a lot of precautionary measure has been taken. On the other hand, Venkat joins us from Jayanagar. Well, Venkat, what is your question for the Deputy Chief Minister?
Good afternoon, both. More of a suggestion to Dr. Ashwath Naryan. I have seen instances where outside of our country we've had situations of congestion fees. So I think that should apply for the city where people are roaming about without any, good rhyme and reason. So fines should be heavily, stifled. That is one suggestion. And second is we should also look at incentivizing some of these retailers to do door-to-door deliveries, right? And being a corporate myself, I would prefer somebody, returning home to hand over my groceries and things of need, essentials, and incentivize these, grocers to maybe a tax benefit or something where in person will both of them lose out in terms of in benefit at store, and then instead of that, delivering someone's homes will make it cheaper, right, for both parties. So these are a couple of things that I'd like to suggest to Dr. Ashwath Naryan. I followed him from basketball days at Malleshwaram. So I wanted to commend his government for some of the steps they've taken with the advisories that the Prime Minister has done.
Now, with respect to the same, the home delivery system is what everyone's looking at too. Can the government, bring up some measure where they can help or aid the people instead of just the online delivery, apps which are there? That is fine. But you can have several volunteers who will be coming forward, or you can request the associations as well. There will be auto association or several of them who can deliver. They can make these trips and it will be much simpler.
What happens, sir? We just try to open little bit more. We'll be defeating the very purpose itself. What happens? It will become mela, and too many people will spoil the entire show. And this is an opportunity, as Mr. Venkat has pointed out, each and every shop establishment should have made use of this opportunity. They should have made use of this opportunity to establish this kind of supply chain. For them to compete with the e-commerce, probably this would have been the best possible opportunity, whatever small or big way they could establish themselves. Even though it is not late, I think the small establishment, whichever is located in each locality, they should make use of this opportunity and reach out to people. This is the right opportunity for them to reach out to each and every houses. Probably, I think through this talk, I think through News 9, I think most of them can realize this opportunity. See, every opportunity, every challenge, every problem is an opportunity for people to change the way they are doing things.
Absolutely. They can bring about a change themselves.
Yeah, this is a right opportunity to make use of this opportunity or the problem or the situation and reach out to the people. And they should do it, they should do well. And if you ask other people, and from the government, we are trying to reach out the ration, each and every house, personal delivery. We are not asking any people to come to a particular place. If we ask them to come to a particular place, again it is a problem, converging of people. We are trying to make sure even the food delivery packet should be given to each and every respective house, wherever there is a request. So that's the reason we have established the helpline numbers. Through the helpline numbers, we'll know which person, which house requires the food, ready food or the ration. wherever they are asking for ration, even the people without the BPL card, we are trying to provide the ration for lakhs together people from the government itself.
For the next 2 months.
For the next 2 months, at least
Yes,
for this month.
yes.
At least for this month, we are trying to provide the ration free of cost.
Yes. Yes.
Free of cost, that is one part we are trying to provide them free of cost, and even the BPL card holders we are providing. Other than BPL card holders also, to the poor people who have been denied their livelihood, we are trying to provide them the ration for each and every family in a very big number, sir. And few lakhs we are trying to provide from the BBMP local body is trying to provide, even from the government we are trying to provide, so that nobody should be denied ration even if they don't have BPL card. Just a Aadhaar card is good enough to establish the identity, because we will not know for whom we have provide the ration.
Correct.
At least one Aadhaar or some kind of authentication where there will be accountability. If there is no accountability, there will be a scope for misuse.
Absolutely. Now, Vittal joins us from Jeevan Bhima Nagar. Well, Vittal, what is your question for Deputy Chief Minister?
So, good afternoon, sir.
Yeah.
So, my name is Vittal. I'm from Jeevan Bhima Nagar.
Yeah.
So, some of the good things that I would like to discuss here is the vegetables, which has been sent by the Thali peoples. So they are instead of we going to markets, people are doing it on a routine basis. That's something that we need to appreciate. Converting these lodges and other things for isolation. So that is one of the biggest steps that even the government has taken. And when I come to the tolls and other inter-state exchange parts where people are struggling to move from one place to another. So can't we not provide some kind of a transport, at least on an emergency basis?
Probably speaking about the migrant workers here.
Yes, sir.
Yes, migrant workers,
So,
they are the ones who have been facing...
Vittal, you know very well, most of the places, just now you heard from Sneha from Kodagu. She's been to her own place. Even after staying after 14 days, now they are going for the stamping of each and every person who has come from Bengaluru. The reason is the migration, they feel they are carrying the virus. That is the kind of suspicion has been built among the people in the society. Anybody coming from outside, even their own person, getting into their village or their town, they feel they are carrying the virus. There could be a chance of carrying a virus which can spread in their place. They don't want any other place from different place to migrate during this juncture. Particularly during this period, they don't want any movement of people to happen. Nobody is willing to accept. That's been a big challenge. And now more so, the government of India and government of Karnataka has been very particular that there should not be any movement of people from one place to another place. Wherever they have been living, they should live in that particular place. Whatever is required to be provided to them, food, shelter, water, any other utility, health examination, all these things should be provided to them. It is a responsibility of the government to provide all basic facility or utilities to these people. It is a duty of the government, and we have been providing, and we are willing to escalate or increase or reach out wherever it is not been provided. We are willing to provide wherever it is and make sure the people should live in whichever place they have been living, they should live there itself.
Now, two important questions which they have asked. One, Gayatri, who's asked for pregnant women, is there a special pass which is needed if they have to go for checkup or scanning, because it is very important at this point in time? How can they reach out to the police? How is it?
There's a helpline 104. Along with that, few more numbers have been added.
Yes.
And government needs to provide this kind of transport facility for them to reach out. Moreover, so even today I suggested to Honorable Chief Minister also to make use of the available Ola or Uber cars for the designated transport facility.
To ferry them.
Since whatever available ambulance is not sufficient enough for many of the people to reach out to these hospitals, because we are not giving them permits to move around. If they need to go, they have to go to the local police station, contact the concerned police officer, ask them to provide transport. This has been a huge challenge. And in this juncture, I feel designated vehicles, the request given from the respective hospital, the patients can contact the respective hospital, the hospital in turn can contact 104, ask them to provide these vehicle, because these companies are willing to provide the vehicle with driver, with diesel, everything free of cost. Probably this facility should be made use to transport all these patients. Then if they need to go to various hospitals, they should not be put into any kind of inconvenience.
Well, you have answered many questions here. Final reaction from the Deputy Chief Minister. We have been seeing how the political circle as well, first ever all-party meeting was held and convened by Chief Minister B.S. Yediyurappa. We have seen the kind of unity that is being shown. So how is it in the coming days after 14th of April? How will the parties work together? How will the government work together to bring back to normalcy? After normalcy is achieved, how will the government tackle the same? Will it be, can we expect the lockdown to continue, or the entire process here, will that continue? How is it going to be?
Sir, first and foremost, tracking of the patients, tracking of the suspected cases or the positive cases, the primary, secondary contacts needs to be tracked. And along with that, the required infrastructure should be provided, and testing should be done, and treatment, all this facility needs to be provided. And the second thing is the social distancing or the physical distancing, the personal hygiene, the contact need to break the contact and make sure the disease doesn't spread around. This is the second most important part. The third important part is the procurement system. The farmers should not be affected. The supply chain should be effectively maintained. The procurement should happen, and all the commodities, whatever has been grown, provided the perishable good needs to be transported, and it should reach out to the respective citizen, and they can avail all this, whatever required day-to-day life required things, vegetables, fruits, or the groceries, or other services, medicine should be provided. The fourth thing is the revival in the days to come. How best we can get up, it is not so far. Within next 14 days, once the revival is going to happen, we need to make sure that the system should respond immediately. And moreover, once after this lockdown period, how best we can ensure again this disease.
But are there talks about increasing the lockdown or extending the lockdown for a few more days?
As on today, we are thinking April 14th.
Okay.
I don't know about the future. I am very confident and hopeful it will end by April 14th.
Well, there you heard it. That was what the Deputy Chief Minister had to say. One small message to everyone. Do stay indoors. Do not come outside. Help the government, help yourself, help the society in ensuring that you can contain the virus.